Hello, everybody. My name is Kate Jalandoni, and I will be your preceptor for your first day of orientation here in our facility. So, today we will be learning and we will be discussing about the blood glucose monitoring. For this specific training, I will provide a direct demonstration and I will be your instructor and I will perform the entire procedure step by step while you observe. All right? So I will use this technique and I will use this teaching method in order for us to be able to appropriately and correctly operate a glucometer and also to correctly perform the blood glucose monitoring. And for our objectives, first, we will define the key terms such as the blood glucose monitoring, glucometer, hypo, and hyperglycemia. Second is to explain the rationale behind the regular blood glucose monitoring for diabetic patients. Third is to identify the situations in which blood glucose should be tested, for example, before meals or when the patient is symptomatic. Fourth is to compare blood glucose readings compared to the normal values and determine if the reading indicates a problem. And then fifth is to judge the appropriateness of the blood glucose results based on the patient's medication, exercises, diet, for example. And the last one would be develop a personalized blood glucose monitoring schedule based on the sample patient case. So let's briefly discuss what's the definition of the key terms that we have. First, glucometer. Glucometer is also known as the blood glucose meter. It is a medical device that's used to measure the amount of glucose or blood sugar in the blood sample. It is primarily used by individuals with diabetes to monitor their blood sugar levels and manage their condition effectively. So, by providing the real time glucose readings, glucometer helps people with diabetes make informed decisions about their diet, about their medication, and physical activity. According to American Diabetes Association or ADA, the normal blood glucose levels, particularly for most people with diabetes taking medication, should be between 80 to 130 milligram per deciliter. So that's before meals. However, for 2 hours after start of the meal, a healthy blood glucose level is less than 180 milligram per deciliter. That's according to CDC. So these are the general guidelines and individual target ranges that may vary on age, health status, and other factors. So, what about hypoglycemia? Hypoglycemia is when your blood sugar or glucose level is lower than the standard range. Glucose in your body is the main energy. It's the main energy source. So, on the other hand, hyperglycemia is where the blood level is higher than the range. So let's now discuss what is blood glucose monitoring. It is one of the most important aspects of managing diabetes, especially for those patients and those individuals who have been diagnosed of type 1 diabetes mellitus and those who are taking which medication again? The one that they're injecting subcutaneously in order to control the blood sugar? It is insulin. So, blood glucose monitoring helps identify patterns in fluctuation of blood glucose or the sugar levels that occur in response to diet, exercise, medication, pathological processes associated with glucose fluctuation, such as this diabetes mellitus, and unusually high or low blood glucose can potentially lead to a life threatening conditions, both acutely and chronically. So, what are the materials that we need to perform blood glucose monitoring? First is glucometer, of course. I have a personal glucometer at home. This is AccuCheck Aviva series, very small. We have several in the hospital as well. The big ones goes with our glucometer. We have to have a test strip that is compatible and not expired, especially. The Lancets and Lancet devices. This is a Lancet device system, very old, very traditional. It's an Lancet pen that we remove this part, the tip where we put a Lancet. We peel this off and then we put it back and then we use. However, since that is not very common now, we have a newer Lancet system that is one time use for each patient. We remove this and then we use this to break the fingertip. Then next is the alcohol swabs, cotton ball or gauze, gloves, sharp container. Of course, I have a big one here, sharp container, and waste bin for our regular waste. Let's now go to the steps. First step is prepare the equipment and itself. Don't forget to perform hand hygiene and put on gloves. In this case, I use my sanitizer and then I already put on my clean gloves again. Sanitizer and then clean gloves, especially if there's no sink and water, flowing water and soap that's readily available. You can do the 99% hand hygiene with a sanitizer. Then put on gloves and then turn on your glucometer. It's on now and it's waiting for the test strip. Test strip that is not expired, put it in here, the bottom part. So we have to remember that each glucometer is different. Always refer to the user manual. Now that the strip is inserted, it's now waiting for a blood sample. As I've previously mentioned, here are the examples of the glucometers that we are using in the hospital and other facilities. The first two glucometer you are seeing in your screen right now, the Abbott and the Accucheck are the common glucometer brands that we use in the hospital. These are big ones. The one below, the Aviva, is the one that I've shown you that I have at home, and then the rest is like commercial ones that can be personally used in home or for personal uses. Second step is to prepare the site. First, we need to choose a finger, typically the side of the middle finger or the ring finger. So we have to have our cotton and alcohol swab. In this case, I have a alcohol swab. So we have to clean the area and let it dry. And for our next step, obtaining a blood sample. Use a lancet to prick the finger. In my years of practice in nursing, I usually wipe up the first drop of blood to get a most accurate result. This is the second drop, our glucometer with our test strip ready to take the blood sample. For our reading, it's 158. In the previous slide, I've already shown you about the applying of the blood to the strip where we touch the edge, only the edge of the strip to drop the blood and do not smear. And for our next step, read and record the result. You can announce and document the result in the patient's chart. You can also inform the patient about the result that you viewed in the glucometer. In this case, it's 158. Again, result is 158. And for our step six, which is the cleanup, make sure to dispose of lancets in sharp containers. Again, I have shown you in the previous slides, we have sharp container. We have the lancets that were used to do our blood glucose monitoring. We can drop it in the sharps container and make sure that it's secured and sealed. Also, discard the strip and gloves to the regular waste bin. We have a regular waste bin. Make sure that you toss it properly and make sure that you remove your gloves and always perform hand hygiene. In summary, the blood glucose monitoring procedure involves these key steps. First, gather all the equipment, then perform hand hygiene. Prepare the glucometer and the test strip, again, not expired. Use a sterile lancet to collect a capillary blood sample. Then apply the sample to the test strip and record the reading. Make sure to ensure the proper waste disposal, report abnormal results, and educate the patient when necessary. The skill emphasizes infection control, accuracy, safety, and patient centered care. So remember that mastery of this skill supports safe, evidence based nursing care and early detection of hypo or hyperglycemia. For any questions, clarifications, or any comments, you can get in touch with me in my email address, katechallandoni@gmail.com. Thank you so much for your attention today, and I hope you've learned something about the blood glucose monitoring. And I hope to see you again soon. Bye.